Yeah. You can see. Okay. Well, good afternoon, everyone. Welcome to Grand Rounds on this beautiful sunny day. We've got a great lecture. Dr. Hariharan has composed for us. Yeah, talk much, Sue. She has prepared an excellent presentation, so we're really excited to hear that. We had a cancellation, and so she graciously offered to give this presentation at the last minute. So I did get the email out on the calendar, but I just hope that everyone saw it. If any of your colleagues near you weren't aware of this, please grab them, round them in so that they can listen and be a part of this presentation today. The session number for Cloud CME is 202. 202. So you'll just text that into Cloud CME half hour before to 2 hours after. That records your attendance. And remember, the evaluation will stay out there for a maximum of 3 months. But really, you want to do it as soon as you can because the information is fresh in your mind. And the speakers really, they appreciate the comments that are made. And that way we can get them everything to the speakers. I always send a post report, and I like to have all of the comments. So it helps out if you can do them fairly quickly. They're not long and they don't take a long time. And then you get your certificate right away, which is really nice too. Okay, I'm going to turn it over to Dr. Matson, who will introduce Luxme, and we will go from there. Thank you.
Hi, guys. Welcome to Grand Rounds. Today we get to welcome one of our own, Dr. Luxme Hariharan. She prefers to go by Dr. Lux. Please join me in giving her a warm, happy 1-year anniversary. She's 1 week out. So there we go. She's the new Chief of Ophthalmology and Chief Population Health Officer here at Dayton Children's Hospital. She completed her Pediatric Ophthalmology Fellowship at the Bascom Palmer Eye Institute in Miami, Florida, an additional fellowship in Pediatric Cornea, Cataract, and Glaucoma and International Health at the Children's Hospital of Los Angeles. And she's passionate about 2 things, global health and blindness prevention. So she's very active on the American Academy of Ophthalmology, the American Academy of Pediatric Ophthalmology, and Strabismus, and serves on the board of directors of Combat Blindness International. She's worked on several global health initiatives with the United Nations, the World Health Organization, and other international nonprofit organizations. And today we have a fun lecture that aligns health with just cool science stuff. So give a warm welcome to Dr. Lux.
Good afternoon. Thank you, Zach, for that warm welcome. It's great to be here, everyone. So the title of my lecture is Total Eclipse of the Heartland. And we'll be talking about, well, before I start, I have no financial disclosures. And this is Dr. Dave Rogers, who is my dear friend and colleague. He's the Chief of Ophthalmology at Nationwide Columbus. I invited him to come present this because this is something he's very passionate about as well. So this is a co-presentation from the both of us. He was kind enough to share slides that he presented as well. So we're doing this jointly. He's here with us in spirit. So Dr. Dave. And solar eclipse, what do we know about the solar eclipse? The interesting thing is that there's a lot of myths in history of animals destroying the sun. And the Chinese believed that a dragon ate the sun. And the Chinese word for eclipse is in fact qi, which means to eat. And there's a Korean myth about the solar eclipse that there are dogs, mythical dogs that ate the sun, and that's what we see. And so these are interesting myths in the sky. And we actually have a lot of myths down here on Earth as well. There's some people who think that being outside during the eclipse, you'll be exposed to harmful radiation or that certain foods are poisonous. But guess what? These are all fears. And what we know about fear, it's false evidence appearing real. And scientists have debunked all of these myths. And really, there's no scientific evidence that solar eclipses can affect human behavior, health, or environment, with one caveat. What we know is that the total solar eclipse, which happens to be coming here to Dayton, April 8th, 2024, in a few weeks, we know that humans will congregate in masses during this time. And it's predicted that almost 4 million people will get together in the path of totality. And this is what is something that we are working towards in terms of safety. And in terms of your eyes, this is really important that anyone watching the solar eclipse, there's prevention in terms of how to do it safely. And this is what I'm here for today, because while it might be one of the most amazing experiences in your lifetime, we don't want it to be the last thing you see. And so we're going to start with what a solar eclipse is. So solar eclipse happens 2 times a year. And there's different types of eclipse. It's the only time where we have alignment with the planet, the sun, and the moon at the same time. And these are the different types. We have partial, annual, and total. And what makes a total eclipse so special is it's the only time when all three are aligned directly at the same time. And this is what it can look like. For a total eclipse to occur, like I said, they must be in that direct line. And the people who see the total eclipse are in the center of that shadow. And we happen to be in the path of totality right here in Dayton. And this is a very unique opportunity to view. People that are outside the path of totality might see cloudiness or just darkness, but we're going to be right in that. And the most amazing things that you'll see. So a sunset that you might view in a regular day, on the day of a total eclipse, it'll be 360 degrees, which is phenomenal. The sky will be dark as it were in the middle of the night. And you might see some stars and planets that become visible that you wouldn't see normally on a typical day. And there's something called the diamond ring and Bailey's beads. And then once again, you'll see the sunrise reoccur. So all of this is what makes this day so special, and the fact that we are in the path of totality right here in Dayton. And this is, again, I mentioned it's April 8th. It's just a few weeks away. And we know that it's going to be at 1508 and it'll end approximately 1519. And this is a place where you can get specific details on what that will look like. But if you look at all the cities on the path, it's very exciting that we're right here where it's all going to happen. So a partial solar eclipse, like I mentioned, is something where the sun and the moon are not exactly aligned, and that's something that we see sometimes. And an annular solar eclipse, this is also known as a ring of fire. And this is something where it looks like this. And this is something actually that happened a year ago in California. It's also an amazing sight, but it's not a total eclipse, which is what we get to experience shortly. And so once again, some facts about the solar eclipse. So we know we can't stare at the sun too long on a typical day. Why? Your eyes get strained, there's some light sensitivity, so you turn away from the sun. And during the solar eclipse, because the moon's blocking it, it might be less light. So it might make you want to stare at the sun more. It might make you want to stare at the sun longer. And this is why prevention is key, because even just looking at the sun for a few seconds, 2 to 3 seconds, without special protection can cause permanent damage to the back of the eye, called the retina. And that's what we're going to talk about today. And actually any part of the eye, but the back of the eye is where we see irreversible damage. And so this is why it is so important that we're all on the same page, that we want you to view the eclipse and enjoy it, but only in a safe way. And so what are ways that sun can typically damage the eye? So we have sunburn, actinic conjunctivitis, which is UV rays. Actinic just means UV to the front part of the eye, the white part. It's called the conjunctiva. This is the front of the eye. Photokeratitis, it's the cornea that gets affected, the front of the eye. So these are things that happen naturally with the sun. And then, like I mentioned, solar retinopathy affects the back of the eye, the retina. The difference between these things is that the first three, it takes about 30 minutes or more for sun damage. Whereas in solar retinopathy, it can be in as little as 2 to 3 seconds, which is why prevention is key. And we're going to stress that today. Sunburn is a common thing you might see in the clinic. And again, this is managed very conservatively. Again, treatment, we recommend cool compresses, over-the-counter pain relievers, topical cream, aloe vera, but sunscreen, UV protection. This is all the prevention we know for kind of surface issues. And then this is a picture of what I mentioned before, actinic conjunctivitis. And as you can see, the areas that are protected by the eyelids are white. So these are the areas that were exposed from the sun. And this is something that we often see in workers that are outside, that work out long hours outside without UV protection. And it can cause thickening of the conjunctiva, which is known as a pterygium or pinguecula, and that can cover the cornea. But this is something, again, that we treat supportive with cool compresses, tears, and it is already from staring at the sun for too long. Solar keratitis is solar damage, sun damage to the cornea. And the interesting thing about the cornea is the epithelium, the initial layers on the front of the cornea, actually absorb the almost 100% of the UV light, and it actually protects the inner layers of the cornea. But if you stare too long without protection, like I said, more than a half an hour to an hour, that can penetrate all levels, and you get a corneal burn or a corneal abrasion, which is actually one of the most painful experiences. Has anyone in this room had a corneal abrasion? Well, okay, Zach. Well, it is probably one of the most painful experiences when your epithelium is sloughed off. And these are examples. Often when you go skiing, you see skiers with sunglasses or UV protection, and that's to prevent this because of the reflectivity of the light. 90% reflectance from the snow can cause this damage to the cornea. And this is fluorescein in a slit lamp, and you'll see the corneal abrasion right here caused by sun damage. And other recreational activities can cause this, sun lamps, even sun tanning. And it really it presents as pain and long exposure to the sun. And then we do a slit lamp exam. This can be treated with an antibiotic often. And, you know, when you are let's say you're in the emergency room that day, or you're in your clinic and you have a patient that comes in with redness, irritation, and light sensitivity, the first question you want to ask is, have they been exposed to the sun? Did they just watch the total eclipse without wearing eye protection, which hopefully after this presentation, nobody will do. But you want to ask about their exposure. And then this is the differential about other things that can cause those same symptoms. Viral conjunctivitis usually starts in one eye or the other, and you'll see viral symptoms before. Dry eye, ask if there's contact lens use, any topical drug toxicity, chemical exposure. In this case, the chemical is the sun rays, any foreign body that we would sweep. But these are common presentations that we often see in our clinic: light sensitivity, irritation, redness, that often are just caused by dry eyes. So it's really important to get the history. And this is what I mentioned about the treatment. It's supportive treatment, but also sometimes we can use an NSAID drop or even an antibiotic to clear the cornea. Now, this is the most important topic that I wanted to address today, because this is what can be caused in 2 to 3 seconds, right? Like I said, the other ones are for longer exposure. And this is something, as the total eclipse comes, I really want everyone to walk away with realizing, if you look at the sun without the proper protection, which we're going to go over today, you can get this. And this is a fundus exam of a normal eye. This is what the back of your eye looks like. This is the optic nerve that's connected to your brain. And these are the arterioles and vessels that emanate from there. And right here, this is the center of the fundus. It's called the macula. And that's the center of our vision. And in the center of the macula is the fovea. We have the highest percentage of photoreceptors, and that's where our visual acuity is, the central vision. And that is what the solar retinopathy affects. This is an example of solar retinopathy where you basically see a hole in the center of the fovea. And that's what the sun will do. And you'll see some other examples of where we can get this. Again, this is an example of how that light penetrates right to the fovea. And if it's focused in as little as how many seconds? 2 to 3, this can happen. And so free radicals destroy that area, and they destroy the photoreceptors. And it's referred to, again, as solar retinopathy because it's the back of the eye, or photic retinopathy. And during this total eclipse, what people are going to want to do is they're going to be excited. They're going to say this is a once in a lifetime event, and they're going to look up at the sun. And this is where, if you look up at the sun without protection, it can cause damage. And even today, people still glare at the sun. You might not feel the pain right away, but within 24 hours, you can wake up the next day and feel this. And so even today, if you go outside and were to glare at the sun, you could get this damage. And so this is really important for people to understand that it's the same sun as any other day, but the total eclipse, we're more likely to stare at it for a longer period of time. And this is why the protection is so important. So what are some symptoms you might feel if you were to get solar retinopathy? You might have blurred vision right in the center. It's called a central scotoma. That's where those foveal burn was, or a blind spot. You can get abnormal color vision. Clinically, we call it dyschromatopsia. Metamorphopsia is the distorted central vision. If you have grandparents with macular degeneration, that's one of the first symptoms that they experience is wavy lines instead of straight. That's at the macula. And you might see objects that are smaller than you think. It's called micropsia. But again, this can be permanent. And this is the part where I really want to reiterate that sometimes it's reversible and we won't know for months if it is or not, but often it is permanent. And this is where I don't want anyone to go blind from something we know how to prevent. And the etiology is classically associated with sun gazing or eclipse viewing. But right now, welding is an example. We have welders that don't use protection. Laser pointers. I just had a kid in clinic actually a few weeks ago that as a fun game, they used the laser pointer in the eye and burned a hole in his macula. He has solar retinopathy from that. So it's really important that this is not a joke. Anything we point to our eye or stare at our eye can damage the retina. And the patient should see an ophthalmologist or optometrist right away if you have any of those symptoms, especially in the next 24 hours if they don't go away. After you're doing some kind of sun exposure, that's where we will do a full workup in the clinic, and it includes all of these things: fundus photos, visual field, and OCT, which I'll show you. This is an example of a fundus photography of solar retinopathy. Again, you can see this area of the burned macula. And this was the patient that had the laser pointer that I mentioned, again, right directly at the fovea. And this is an ultrasound of the back of the eye. So to give you some perspective, this is the inside of the eye, the retina, the vitreous inside the eye. And here are the layers of the retina. And right here is called the pigmental epithelium in the ellipsoid area, right at the center of the fovea. So if the light comes in, right here, you can see the disruption of the ellipsoid area of the outer retina. And that's where the damage occurs. And so this is an ultrasound that directly shows that hole, again, irreversible. We don't have treatment for it. And we often get a visual field. And in this visual field, you'll see this is a blind spot. And that is an area where there's centrally where you don't have vision. It's called a scotoma. And often this test confirms that it's in that same location that the OCT showed in the foveal area. And that can be very uncomfortable if everywhere you look, when you move your eyes, you see a dark spot, and so this is something that we absolutely would like to prevent from our solar eclipse classes, which we'll be talking about. And here, the final test that we get is fluorescein angiography. And what that does is it lights up the vessels. You take fluorescein and it lights up the vasculature of the retina. And again, that ultrasound or the OCT imaging shows the foveal hole where right here you can see the damage in the fovea, and here you can see the hole. And the interesting part is when we light it up with the angiogram with fluorescein, what do you notice? You see a window defect right here. Normally this should be dark. So if their fovea was there without the hole, you wouldn't see the underlying vessels. And the underlying vessels is the choroid beneath the retina, and that's what we're seeing there. So the loss of the photoreceptors underlying the retinal pigment epithelium is the medical defect that we see from this light. And this is an 11-year-old that did the laser pointer. Again, you can see that there's a dimness here, and then this is a normal fovea. You can see the nice reflectivity, and here it's dull. And again, the corresponding OCT. This was a kid that actually didn't do it for very long. So you can see that there's not a hole, but there's scarring in that area. So this was with a laser pointer again. So this is something we see almost once a month, with kids playing around. So if you're in your as a pediatrician, make sure that that this is not, as a teacher to your family friends, that this is not something we want to joke around about. And the treatment, like I mentioned, we don't have any evidence-based treatment. There's some antioxidant support, supplements that can be taken, but basically we have to wait and see what happens. And oftentimes it's irreversible from 1 month to a year. And sometimes people will never get their vision back from this. And this is why it's so important that the only thing that we have control of is prevention. Prevention through education and through things like today, talking through grand rounds and passing this message along, that is actual evidence-based of what we can do to prevent this. So before we go into how to prevent this and how to safely view the eclipse, the one interesting thing that came about, the knowing that solar retinopathy can burn a hole in the retina, is this ophthalmologist from Germany, Gerard Edmund Meyer Schwickerath. He noticed during the total solar eclipse in 1945, all of his patients with what I showed you before of solar retinopathy. And he started thinking about how can we use light to photocoagulate parts of the retina for different diseases. So he actually made a telescope outside the building of the hospital in Germany that took light and reflected it inside the operating room, which he used to treat retinal detachment. So he focused light as a way to photocoagulate blood vessels in retinal detachment, which is pretty interesting in 1949 to come up with that. So that was the first successful treatment of light coagulation. So even from things, this is where science is so amazing, is we can come up with creations from things that we see patterns in. And he then went on, he's known as the father of light coagulation or photocoagulation, and the predecessor of the common laser that we use for diabetic retinopathy, photocoagulation. And this was all from the total eclipse in Germany, from seeing so many patients with solar retinopathy. So we did learn something from this, thanks to Dr. Schwickerath. And why is it important to us today? Everybody, not just in Dayton, needs to be aware of the eclipse that's happening and how we can prevent solar retinopathy. And how do we safely view this eclipse? We want everybody to enjoy it, all the things, but how do we view it safely? And there are three main ways to view it safely. One is with the pinhole or projector method, which I don't recommend because it is difficult to create, and I'll show you how to do it. The second is the solar eclipse glasses or solar filter, which I do recommend because it's the only direct way to look at the total eclipse, and you all will be getting these. So that is great. And then watching the NASA live stream. These are the only safe ways of viewing the eclipse. And the pinhole viewer, like I mentioned, this is a reputable site of how to do it. But the key of doing the pinhole is you don't look at the sun directly through the pinhole. You have to look away from the sun. And so that's the part of this where I think people might kind of peek and not do that. So what I recommend is the safest way is with solar eclipse glasses. And this allows you to view directly at the total eclipse in a safe way. And what they are 100,000 times darker than regular sunglasses, and you put them on over your regular glasses. And the way to safely view it is, if you're outside, you're going to first look away from the eclipse, put them on, then look at it, enjoy it, look away, and then remove it. That is the only way. You want to make sure that they're not damaged. You want to make sure that it says ISO 123. It's the standard, the ISO 12312-2. That is the only safety code and safety standard. There might be frauds out there right closer to the eclipse, so make sure that it says that on them, and make sure that they're not broken. Don't keep them in your pocket because that might bend. So make sure that they're safe and they fit around your contact lenses or glasses when you're wearing them. Do not put them over sunglasses. Put them directly on while you're viewing it. Even through a window, anytime you're viewing directly at it, this is what I want you to use. This is the only way you can safely view it, is with these solar eclipse glasses. And again, this is what I talked about there. You put them on before looking at the sun and look away and take them off. Again, that's very important because if you're watching and take it off, 2 to 3 seconds is all we need for that light to penetrate the fovea. So safely viewing with the solar eclipse glasses is key. And again, the NASA live stream is the other safe way we're going to be. That's something that anybody can look at through this website. And the best part of it is it will be, if it's a cloudy day, it'll be a way to kind of view this in a safe, fascinating and safe way. And are we overhyping the total eclipse? Is this something that we're kind of saying it's going to be great? But I don't think so, because if you're outside the area of totality, perhaps. But guess what? We are right in the path of totality, and it is going to be exciting. And we're going to get to see, this is an example of what was seen in August of 2017. We have no idea what we can expect, but it's going to be something exciting. And you can't overhype it because these are all the things that have been known with the total eclipse. You have partial phases, slender slivers, Bailey's beads, a diamond ring. It's an astronomer's heaven with all these wonderful things to see. And again, the 360 degrees of a sunset and the sunrise in the middle of the day. So we want you to enjoy it, but we want you to enjoy it in a safe way. And again, this is where it's going to happen. We're in the path of totality, the time that it's going to happen. And the best thing about preparedness is we're doing it as a team. And right here at Dayton Children's, we're working really hard to make sure that everybody's safe, our patients, our employees, our staff. And that's a team effort. And that it requires all of these groups have been meeting months and months to plan for this day to make sure that you guys are safe. And we actually have one of the key people in our audience today, Mark Moore, who's our Director of Safety, who's going to talk about some of the strategies that we've been already doing right here to keep you safe.
Hi, everybody. Can the folks on Teams hear me?
Yes. Yes.
Terrific. So just very briefly, on the 8th of April, we are going to institute our code yellow, which is either an internal or in this case, an external disaster code. We're not doing that because we think that the world is going to end. We're just trying to make sure that hospital operations run smoothly and that those things that we're the most concerned about are addressed immediately if they come to pass. We are going to institute, as part of that code yellow, what's called the Hospital Incident Command System. So there will be a double handful of folks, including Dr. Lux and myself, in the Hospital Command Center up in the executive boardroom on that day. We have done a hospital-wide risk assessment. I worked with some of the smartest folks in the hospital. I was not one of those, but I worked with them to make sure that we assessed all of the risks that were foreseeable. And you see the three biggest ones there. Transportation failure, just as an example, I know two people who work in the hospital who went to Nashville to see the total eclipse in 2017. It took one of them 13 and a half hours to drive home from Nashville, and it took the other one 17 hours. Traffic may be absolutely horrendous. It may be bad leading up to the eclipse. It may be horrendous after the eclipse is over, after the totality is over. Obviously, information systems failure would be bad. If we lose Wi-Fi, we lose Vocera, we lose lots of the things that we use all the time. So we're working with our IT friends to make sure that that doesn't happen. And then communications failure, it is entirely possible that we may all lose cell phones for a period of time just because cell phone towers are overloaded. It is recommended by the Ohio Hospital Association that we all send text messages that day rather than phone calls because they take less bandwidth. But there will be people who are taking pictures and sending them and streaming their video from their phones, and all of that's going to take up cell tower bandwidth. So we may lose cell phones for some period of time. As Dr. Lux said, we've been doing operational planning for quite some time. This is one of those interesting things where I've heard all the complaints from, why are we panicking about this? It's no big deal, to, oh my God, you didn't start planning soon enough, we're behind. So I think we may have it just about right since we're hearing that on either end. Certainly we're concerned with the areas not only for inpatients, and Dr. Lux has very clearly addressed the inpatient nursing staff about how they need to protect their patients and families. Many of the ambulatory clinics are shutting down early some earlier than others, but the goal there is to try to get those patients and patient families home before the traffic gets horrendous. And then obviously the anticipation is that if we get an influx of patients, whether it's because of eye injuries or whether it's because of kids who have been in a trauma such as a traffic accident, things like that, that we might see more of those, because apparently in Nashville, folks just went from 70 miles an hour on the interstate to 0, threw their car in park and got out and watched the eclipse on the interstate. So that can obviously cause some problems. Does anybody have any questions for me from an emergency management operational planning standpoint? Okay. Thanks, Dr. Lux.
Thank you, Mark. We appreciate all of your efforts in keeping us all safe. And not only do we have Mark working hard, but we have our amazing marketing and strategy team, and they have partnered with Boonshoft Museum and On Our Sleeves movement, and we have offered 1,600 eclipse glasses to local families. Sorry, 16,000 eclipse glasses to local families in the area. Glasses are shared with Centerville, Parks District, Springboro, and through Boonshoft Museum of Discovery, we've been learning about the science of the solar eclipse and what exactly it is. Through Dayton Children's, how we safely view the eclipse with solar eclipse glasses. And then the On Our Sleeves movement captures feelings about the eclipse. And there's actually, I've brought some of the materials that they've created about an eclipse contract, a safety contract that we're having families sign to ensure that children know that this is something that's going to be exciting, but it has to be done in a safe way. So this is really a creative, interdisciplinary approach. And currently they are working on videos and social media that you'll see leading up to the eclipse with all of these components. But it's a very exciting opportunity because we're right here in the path of totality to educate and keep everybody prepared and aware, and the science of it, which is also exciting. So this is something that we can pass around. I want to make everybody have access to this, and so you'll see these. And we, like I mentioned, we've been filming different episodes that will be aired throughout social media, throughout Focus, so that you will be prepared as we lead up to April 8th. So everybody through the Dayton Children's community, our families, our patients, will be aware of how to protect their eyes, how to protect themselves, and what are safe viewing strategies. And all of these can be downloaded from this website, all the resources that I mentioned, as well as some of the things that I brought today. And again, I would like to stress, if by chance you notice, people that have looked at the eclipse without these solar eclipse glasses or in an unsafe way, and they experience the symptoms that we discussed, like blurred vision, central vision, distorted vision, flashing lights or floaters that don't improve over 24 hours, and they were exposed, please contact us at Dayton Children's Ophthalmology, Optometry, and Opticians. We are here to help. We are here to serve. And we are excited to see you. We are our one-stop shop for children's eye care, and we're right here at home at Dayton Children's. And many of you might not know, but we have pediatric opticians, pediatric optometrists, and pediatric ophthalmologists all working together as a team. And that's what makes us so unique. And this is a little Venn diagram just to show the difference, because a lot of people don't realize, doctors of optometry, we're surgical medical doctors of ophthalmology and opticians, but all trained in pediatrics. That's what we have right here. And this is Betty Brewer. She's one of our most amazing pediatric optician that fits children's glasses in just the right way. It's not like going to Walmart or Walgreens. And so when a child fails a vision screening, it's really important they get the right refraction and the right type of glasses to fit them so they can maximize their vision. We have our amazing optometrists, Dr. Amber Dawson and Dr. Catherine McDaniel. Dr. Dawson specializes in children with special needs. And we even have Elise Hurley, Huntley, would you please stand up, Elise? Elise Huntley. She is with Child Life, and she's working to help make sure kids that need accommodative visits that might not be nonverbal, might have developmental delay, autism spectrum, that we can still quantify their vision. We're not turning them away. We're going to make it a special visit for them so that we can maximize their vision. And that's something we're doing right here with the help of our Child Life. And Jana Ives, our clinic manager who's here, she has an iQuick project that's talking about this. And this is something that I'm not aware anyone's doing in the country to quantify vision in these children. And so it's really very special. And Dr. McDaniel comes to us from OSU. She was the chief of optometry there. Her specialty is in myopia control in children with brain concussion, traumatic brain injury. And we're so excited to have her. So please come visit. And myself and Brenda Young, who's been here, Dr. Young has been here for the last 2.5 years. And she comes to us with over 20 experience in surgical, clinical ophthalmology, one of the kindest, most caring ophthalmologists you'll ever meet. And so she is here. All of us together are working to make sure that your child is taken care of in a compassionate, caring way. And this is our entire team. We have people here. In fact, it's the birthday of two of our members. And so they're celebrating a birthday right now. So this is really important to us that we create a culture of compassionate care for each other and the children that we take care of. So just to share with you what we've been working towards in the last year. And here are some additional resources about the eclipse in general. And again, it's really important, that there's a lot of myths out there and things that can happen. So you want to go to evidence-based sources. And what we've shared with you today is, the way to protect yourself, the things that can happen, but we know how to prevent it. And these are additional resources where you can go to get more information, and including right here at Dayton Children's, the website that I shared earlier. And I'd like to share this little video that Dr. Dave and I created, if it goes through, this little fun video. Oh, okay, let's see.
Hi, I'm Dr. Dave Rogers.
And I'm Dr. Lux Hariharan. Dr. Dave, did you know that special eclipse glasses are 100,000 times darker than regular sunglasses?
Wow. Does this mean you can't wear regular sunglasses to look at the sun?
Absolutely not. You have to wear the ISO certified eclipse glasses to look at the sun. Otherwise, you could go blind.
Wow. Well, did you know that for a total solar eclipse to occur, the sun, the moon, and the earth need to be in perfect alignment? Scientists call this syzygy.
Well, I call it pretty cool. You know what else is pretty cool? Tune in April 8th to watch the total solar eclipse with your certified ISO eclipse glasses and be safe. We'll be watching. Will you? Wonderful. This is pre-Oscars. I know we'll take autographs later. But Dr. Dave, he is the chief at Columbus, and they're very passionate about this there as well. So we're working really closely with their team. And I think before we go to questions, I think the one thing you can walk away with today is that all of this is preventable, which is safe practices, and you're going to be excited. It's going to be thrilling, but just make sure that you're equipped beforehand. So make sure you have these solar eclipse glasses with you. If you have questions about where to get them, like I said, we have through the websites here at Focus, and we'll be distributing them to all our employees and staff. There's a whole distribution process that we'll be launching in the next couple of weeks. But as long as people that ask you what to do during the eclipse, now as long as you wear the solar eclipse glasses and you wear them over and you look directly at it, look away and take them off, you'll be safe. And I think that's the one message I want to alleviate fear and make it fun and safe, because it is exciting that we live right here in Dayton at the time of a total eclipse in the path of totality. This doesn't happen very often, so we should all enjoy it together and safely. Thank you very much. Is there any questions?
Okay, there's a few questions from folks online. So Lisa Reynolds asked, can we still get the glasses through Dayton Children's? Sounds like the answer is yes.
Yes. So we do have a plan for all of staff receiving glasses. The details of that will be kind of launched. We have a whole solar eclipse team that's actually meeting today at 1:00 that is charged with making sure that everyone has protection. So glasses for everybody.
Check your emails and check Focus.
Yes.
That's where it will likely be announced.
Right. And again, if you're getting them offline or online, as long as it says the ISO 123-2, that is the certification of safety. So make sure it says that, and make sure that they're not broken, that you can bend them and put them over your glasses. So that's really important.
And if you want to take pictures, I know for a fact you can buy little filters to put over your camera phone to take pictures of it through Amazon. About $10 and
But you
something.
still want to, you.
Oh yeah,
you
absolutely. You need the
Yeah.
glasses.
The glasses. So
Yeah.
like, I think, a lot of people thought, can you just look through your phone? Is that safe? It's not. If you're not wearing glasses, or even if, any extra tool that you're using to stare at the sun is just going to amplify it if you're not wearing protective eclipse glasses first. So that is really key. If you think of that picture I showed you with the light penetrating to the retina, that's what's effectively happening without kind of blocking it. So, and these are dark. I'll pass these around. These are 100,000 times darker than regular sunglasses. So you can't drive with them. You can't really do anything with them except for view the eclipse. And so having them handy before that is what is key. So
Now, our safety officer had left, but you might know the answer to this. This comes from Goji Kumar. Given the anticipated bad traffic and frenzy surrounding the eclipse, are we planning to cancel or reduce clinics?
So I believe
Hey,
there
hey
is
Zach,
a-
it's Jessica Hallam. I've got an answer in for that one.
Oh, great. Go for it.
Thanks, Jessica.
All clinics have posted their operations plans. And so those operations leaders would know what each individual clinic plans to do, because it's different just depending on where and who and what. So Gogi, Jack would have the answer to that.
Are there any questions in the live audience?
Thank you so much. Is there a time limit for wearing the glasses and staring at the eclipse? Like, could I watch it from start to finish and not worry?
That's
Cool.
a great question. As far as we know, as long as you're wearing the glasses, you can watch it the entire time. Those are polarized with the safety filter, with the ISO. That, as long as you're wearing them, and again, you're looking away and taking them off. But yes, the whole point of them, is to do it. And actually, there's certain schools. I think there's a photo here where this school made it the principal actually made it a viewing event. And I believe we're going to be doing that here at Children's. We're going to be having some viewing events, like for those that are here, so that everybody can view it together with the glasses on. So it is safe with the glasses on. Again, I think the thing that I want you to think about is, even if you're looking outside a window, even if you're looking, anytime you're looking directly at the eclipse at any time, that glasses have to be on. That's it. But if you're just walking outside to your car, if you're just outside, that's not, those are not times you need to have the glasses on. It's just if you're looking up at the sky at it. So I think if you walk away with that, that'll be a good, no eclipse viewing without eclipse glasses.
All right, I have one more question online from Melissa Armstrong. She says, home care would like to be involved as we have staff out in the field. Can you tell me the times traffic is expected? So again, our safety officer has left the auditorium. So if there's anyone online that knows the answer to this, feel free to chime in.
So what we predict, right, is that masses are going to gather during that time of, and this is what this map might be changing at each time, but this is the timing that we know of the eclipse to happen, is at 1508 to 1519/20, and this is a real-time eclipse simulator. So I think just with basic prevention, that there's going to likely be traffic all day. People are going to be coming in from out of town to come to the path of no totality. So I don't think we can, I think we can predict, hopefully, that during this time is when people will probably pull aside at the side of the road and gather in groups and stare at the eclipse. So that's something based on human behavior we can predict. But in terms of traffic, I would say all day.
Any other questions in the audience? Okay, thank you.
Thank you very much. Come on by for some pamphlets. Thank you. Thank you. Yeah. Thanks, Zach. Yeah.
Yeah, I've already picked up my glasses.
Yeah.
So there's the smartphone filter, so I can take pictures.
Yeah.
You don't look through your
Don't
phone.
look through it.
Yeah, there's
Yeah.
NASA certified and everything. ISO.
Yes, yes, hopefully that was clear, so people don't get all excited. 'Cause
I think if
people
you
are like,
slept
oh,
through
it's,
half the lecture, you get the message. Needs to
Good.
be ISO.
yeah, great, job. Yay, 14.